Here today, Dr. An. Thank you so much, Biogal, for this opportunity and for making this wonderful webinar possible. I enjoy Titer testing, and the aim of this webinar is for all of you to be comfortable to do the same in your own clinics. I moved from England to New Jersey, USA in 2015. So I'm now a DVM here, licensed to practice in New Jersey as well. So I'm hoping that my experience in India, in England, and here will help you all realize how important this is. So welcome everyone, and thanks for tuning in today. I'm now going to share my screen and go ahead with the webinar. So the main aim of this webinar is to show you how you can successfully implement Titer testing in your very own clinic. And the learning outcomes I would like to elucidate are going to focus on what core vaccine Titer testing is, why it's important, and also how you can go ahead and incorporate this in your practice. So to start off, we will define core vaccine Titer testing. Then we will talk about a review of why core vaccine Titer testing is so important in clinical practice in today's world. I will talk about my personal experience and a point of care model for the same. And finally, I'll give you a simple way of how you can implement it without worrying about loss of revenue and making sure that we are all practicing evidence-based medicine for the sake of the pets and the pet guardians. So I am a big follower, and I trust what the World Small Animal Veterinary Association tells us. And there is no doubt that vaccination is vital, and it's a very, very important contributor to wellness of an animal. I am not an anti-vaxxer, and this is something I would like to make very clear. Vaccination is necessary, and we need to address how important it is simply because even today, in spite of all the vaccinations we've done, in developed countries, there are still geographical pockets of infection and sporadic outbreaks of the key diseases. And in developing countries like India, for example, we find that you still see a lot of diseases on a regular basis, and they can be a major cause of mortality in small animals, even today. As you all know, you've probably heard the term herd immunity. Vaccination is not just about one individual animal. It's about providing optimum herd immunity that protects a lot of individuals and minimizes the likelihood of sudden disease outbreaks. So when we talk about herd immunity, we are basically talking about protecting a population. And this is the biggest takeaway I want you to have from this webinar, and that is you need to have vaccinated more number of animals rather than just repeatedly vaccinating the same animals in order to attain herd immunity. So please, please remember this point, that we really, really need to vaccinate more animals, but at the same time, we need to focus on the numbers rather than repeated vaccination of the same animal. So I hope that makes it clear. The next slide shows you a very good reason, another reason why we shouldn't be vaccinating the same animal again and again if it's already protected. The vaccine guidelines in the WSAVA are very clear about it. They say it's important to reduce the vaccine load on individual animals so that you can minimize the possibility or the potential for adverse reactions to the vaccine products. It could be the adjuvant, it could be the protein, it could be the actual killed virus. For whatever reason, we have to try and do our best to minimize these adverse reactions, which is why they went ahead and made the proposal, after doing a lot of analysis and studies, that vaccines should be divided into core vaccines and non-core vaccines. So core meaning compulsory and non-core meaning optional vaccines. That's the simplified word to explain it, but there's more to it. So let us say that we all know that a large majority of dogs can maintain protective antibodies against the canine distemper virus, the canine parvovirus 2, the canine adenovirus 1, and adenovirus 2 for many, many years. And there are many studies that have supported this. So this is based on strong evidence. And there is proof that the duration of immunity after vaccination with a modified live vaccine is as long as 9 years, and sometimes it can be as much as the lifetime of a pet. And again, this is based on challenge and serological studies. One very good paper I would recommend you all read is in the Journal of Comparative Pathology 2010 by Dr. Schultz and Thiel and Mukhtar. And it talks about the duration of immunity and also about the age and how long it lasts based on modified live vaccines. So please, if you get a chance, look up this paper. You should. The reason I'm specifying modified live vaccine is that there's a difference between what a modified live vaccine does versus what a killed vaccine does versus what a recombinant vaccine can do. And it's the modified live vaccine that have been proven to have the most DOI. So, you can do a little bit more research if you would like, but it's very fascinating to understand that. So it's not just any vaccine. It has to be a modified live vaccine to have the longest immunity. So let us see the difference between core and non-core vaccines. The simplified way was calling them compulsory and not compulsory, but in reality, a core vaccine is a vaccine that is required by every dog and cat in order to protect them from life-threatening infectious diseases that are still prevalent throughout the world, okay? And these usual diseases are such that prevention is far more cheaper and far more better than the actual cure. And sometimes you cannot cure them. In fact, all you can do is give them supportive treatment, which is why it's called a core disease and a core vaccine. The non-core vaccines are required based on geographical location, the local environment, the lifestyle, and also based on the animal's risk to contracting a specific infection. And these vaccines usually require an annual booster. This is something you should keep in mind. So an example of this could be something like lepto, whereas an example of a core vaccine could be your parvo. I will explain this more in the next slide. So here we go. So these are the core vaccines which can be titer tested accurately, and they are in dogs, the hepatitis, ICH, the parvovirus, and the canine distemper. And in cats, it's panleukopenia, the herpes virus, and the Kalichi virus. I'm going to focus more on the dog canine vaccines today, simply because my experience is more, as far as titer testing goes, with dogs. And also because I find the testing far more accurate. So what does a core vaccine titer testing show us? Okay, so it will clearly show us that a pet is immunized or not. So to define it, a titer test for core vaccines reveals if a pet is already immunized from a previous vaccination by actually detecting the antibodies. If an animal has antibodies, then there is no need to revaccinate because in essential, the reality is that you're already protected. Hope that makes sense. So again, going back to the World Small Animal Veterinary Association guidelines, they have confirmed that for the core diseases in both dogs and cats, there is a very good correlation between the presence of serum antibody and protective immunity, and therefore these antibody tests may be useful in monitoring the immunity. And as far as dogs go, the serological testing for canine distemper virus, the canine adenovirus, and the canine parvovirus. And as far as cats go, the feline panleukopenia virus, we can say for sure that this testing has shown that it is effective in predicting the protective immunity in the puppy or the kitten. It also gives us advice on how often you need to revaccinate adult dogs. And it also helps us manage infectious disease outbreaks in shelters in a much more better way rather than blind vaccination. We'll explain more about this in the next slide. So if you look at the very first picture, you will see that one of the key indications, both by the AAHA and WSAVA, is that puppies and kittens can be titer tested after completing a vaccination series when they are about 6 months of age, that is after 24 weeks of age, in order to confirm that they are actually immunized. This is the key word. Vaccination does not necessarily mean the puppy or the kitten is immunized. And that could be because vaccine failure is definitely possible. It could be because of their genetic non-responders or because the vaccine itself has poor immunogenicity. 24 weeks, you might ask, why is that? And that's because we have to ensure that the maternal antibodies are out of the system, and it's also the recommendation of the WSAVA to wait that long before you titer test puppies and kittens to confirm immunization. Another good way is to check if a geriatric or a sick pet who is not necessarily a good candidate for a booster vaccine already is protected. So we know very well that you shouldn't be vaccinating a sick or immunocompromised or an animal with immune-mediated disease like immune-mediated hemolytic anemia or immune-mediated thrombocytopenia, and an animal that has a previous history of a severe adverse reaction to vaccine administration. So in these sick cases, the titer testing is a great idea because by looking for antibodies, you can be sure that this pet is vaccinated or, correct me, immunized. Another good application is in just the adult pet. We can see if it has antibodies, and we can also see if it has already had prior vaccination, because this will be confirmed by the titer test. You can also see, if, let us say it's a dog with unknown history, you can do a pre-breeding assessment of its immunity. If it was an expensive stud or a bitch, a dam you were going to use. And finally, if you have an emergency and you have a dog admitted in the hospital, you don't know the vaccination history, you're worried what to do. You just have to do a titer test and you feel so much more happy that you have an animal that is immunized. So you don't have to worry about, you can take those core diseases out of your list of differentials as well. Finally, what I find very useful is when I'm here in USA, I have worked for some shelters, and most of these dogs that come in, you don't know who the owner is. You don't have a vaccination history. So just by titer testing, you can know if this animal is protected for distemper, protected for parvo, protected for infectious canine hepatitis, and you don't have to worry about isolating, because the moment they are protected, it's good for you. And also, you can manage a disease outbreak, because by titer testing, you know who is the one who, even though was vaccinated, did not produce the immune response and maybe contributed to the outbreak. Hope that's a lot to take in, but if you think about it logically, it makes a lot of sense. Basically, titer testing is your proof of immunization as opposed to just vaccination and believing it's worked. So as far as puppies and kittens go, we talked about it in the previous slide too, but I thought I should reiterate the reason why titer testing them is important. And that's because some vaccines are poorly immunogenic. So immunogenicity, if you think about it, is the ability of a vaccine to provoke an immune response. And it can fail for a number of factors. And for example, there might be a problem with the way the cold chain was interrupted. So the vaccines have to be stored at a certain temperature. It's possible that somewhere down the line that was messed up, so the vaccine is actually not good. But you didn't know that. You vaccinated the puppy and the vaccine didn't work. Or it could be because you gave too little a dose, because I have seen some people worry about, oh my God, this is such a tiny chihuahua. Why am I giving so much vaccine? And you might think it's best not to give that much. Or you might miss, or, I have known some people who have injected a cat vaccine into a dog because they've been so busy. I mean, it happens. And the puppy is not protected, and you probably didn't realize. And the most important reason could be that there are maternal antibodies circulating, which stop the vaccine from creating that response. And then you have this important reason. The animal could be a poor responder. Its immune system intrinsically fails to recognize the vaccine antigens. As a result, the animal is not immunized. And here's some data to tell you that genetic non-responders in the dog population can be as much as 1 in every 1,000 dogs for canine parvovirus, 1 in every 5,000 dogs for canine distemper virus, and 1 in every 100,000 dogs for canine adenovirus. And they might look like not so big numbers, but for that particular puppy or dog, it could be life and death, which is why when I worked for the PDSA in England, I have seen that even puppies that have been vaccinated for parvo, supposedly vaccinated with proof, have come in with parvo. And, you find it surprising, but for all you know, these could be one of the reasons. So moving on to the next slide, the WSAVA has then come up with this publication which talked about what sort of titer testing in kits would work. So based on that, they have come up and authorized or okayed certain rapid and simple in-practice serological test kits that are able to detect protective antibody specific for canine distemper virus, adenovirus, and canine parvovirus. And 2 commercially produced test kits are available. They have been applied and validated both in a clinical practice setting and a shelter setting. And they are popular, and I can vouch for that. And it's excellent for those of us who want to practice evidence-based medicine. And we can offer clients an alternative to just routinely vaccinating animals with DAP every 3 years. And one of those kits that I personally am a big fan of and have experience with and use a lot is the VacciCheck by Biogal. In fact, apart from sending off the rabies, Titer testing, when I used to issue pet passports in England, I used to constantly send off blood to after vaccination, with rabies vaccine. You have to send the blood off to ensure that they have enough titers. Otherwise, you cannot really sign the passport and confirm that this dog is protected for rabies. And, that is your classic example about how just vaccination is not proof of immunization. And because England is rabies free, we had to ensure that when an animal traveled abroad, it was protected from rabies. So anyway, a bit of diversion there, but coming back to this. So as far as in-clinic titer testing goes, I use VacciCheck. And if you can see this picture here, this is how the kit looks like. It's very simple. And it has the, you can see like a little comb over there. That is the immunocomb. And you can see that, and that is the developing plate. The developing plate contains the reagents that are needed for the comb development, and the comb, that one, you will find it has antigens attached to each tooth, and the placement of the antigens is shown by the labeling on the comb, which I will show you in the next slide. So this is an example of a VacciCheck developed combs. And you see the numbers 1 to 12 are referred to each dog or each blood sample. So this could be dog 1's blood, dog 2's blood, dog 3's blood, all the way to 12. So the beauty of VacciCheck is that you can do 12 samples in one go, okay? And if you look at this, the first one is the positive reference or the control. And then that's canine adenovirus, canine parvovirus, and canine distemper virus, okay? And this is your, again, this shows you. I wanted to move on to the next slide because this explains what that color intensity was. So take a look at the previous slide and you will see that there are, in this one, for example, this is the control and all these look almost same color. This one, this is darker, this is about the same, this is a little bit lighter. So this is very important and it's actually not as difficult as you might think. In fact, it's pretty straightforward. And you can, the next slide will explain how. So if your color intensity is white or has a trace of gray, it basically means the test is negative. There are no detectable antibodies for any one of these 3 diseases, okay? And then you give it a score of 0 to 1. If there is a faint gray as compared to the control, you can say that it's a weak positive and you would give it a score of 2. And if it's a nice distinct gray, it's called a significant positive and you would give it a score of 3 to 4. And this one is what we would all like to see, but doesn't always happen, is the high positive. And that shows a dark gray and we give it a score of 5 to 6. The important thing to know is this sentence. Just because the particular dog came up with a weak positive doesn't necessarily mean that it has no immunity. The presence of antibody, no matter what its titer, indicates protective immunity. But if it's negative, it means that you have to revaccinate, because it clearly shows that this animal has no antibodies for this. And going back to the previous slide, you might find a situation sometimes. So take 5, for example. This is clear because it shows that there is immunity for CAV, for hepatitis, parvo, and distemper. But sometimes I have seen cases, in fact, my own dog, Joy, I did his Titer test recently because he came from rescue, and he had strong positive for parvo, strong positive for ICH, but negative for distemper. And he had been given a vaccine 2 times since he came to the rescue, and he was about 4 months old when he came there. So if I hadn't Titer tested, there's no way I would have known that he's not protected for distemper. You could argue that distemper is not big now, but he's under 2 years old, so he still has a chance. So then I decided to vaccinate him for all 3, because, you know, it's hard to get a distemper vaccine on its own, but I did it. But if you can, and let us say a dog showed high positive for distemper, positive for adenovirus, but did not fail the parvo, you could always just give it the parvo vaccine. So you see, you're basically doing the right thing by the dog by giving it what it needs. So this is important. If there is a medical reason not to vaccinate the dog, then you shouldn't. But in most cases, like my dog, for example, if an antibody is absent for a particular disease, you should be revaccinating the dog to protect it. This one was actually a game changer for me, because I like the whole visual thing because it's pretty straightforward. And, you know, the more you do, the more better you get at it. But this one helps me confirm that what my eyes are seeing is right. So what you can do is, if you look at the comb, there is a little, you can break it, that line. So you can break this comb into individual comb where you have that little indent. So you can break them and read them as individual results using this device called ComCam. It's very tiny, and it comes with 2 separate cards. One is for the canine VacciCheck, and one is for the feline, for the VacciCheck. And I found it very useful because I didn't have it in England, but I have it here in USA. It was brilliant. You just slide it in, it immediately gives you the score, and you know the result, and you don't have to worry if it's a small gray, slight gray, you know, you don't have to worry about any of that. It gives you the value. It can be connected up to a PC or laptop, and you can do electronic documentation. So it's basically an electronic eye. And I like to test everything before I tell anyone. And I like to double check myself, double guess myself. And this is great because I will do my reading, and then I will double check with this. And I would recommend this little handy electronic eye. It made my job, how shall I say, it made me a lot more confident when I was reporting the results. Okay, so now we come to the topic of how you go about implementing Titer testing in your actual clinic. This is actually the main focus and the most interesting part of today's webinar. But I would like Dr. An to come in, and he wants to do a small poll with all of you, and then I will come back and talk about this.
Great. Dr. Sathish, you've done a great job, and I wanted to say that the questions have been pouring in. So obviously people are very inspired by your presentation. You are creating a lot of thought-provoking questions and ideas, and I think we're going to have a fantastic Q&A session. So folks, we are going to continue to ask you, please send in the questions. I'm really impressed with the quality and the thoughtfulness of all of these questions and points that are being made. And we are going to actually not run the poll today. We'll run that on another day. But Dr. Sathish, you've done a great job, and let's let you resume to the second part of your presentation, and then we'll have the Q&A.
Okay, it's fine by me. I've had my little water break, so I'm going back to screen sharing now. Okay, so I have put this into 4 sections because these are the 4 ways I do titer testing. Or 4 situations where I would titer test, okay? As part of the annual pet health check, as part when you complete a puppy vaccination course, and that's, I reiterate, should be between 6 months or 1 year. And this is my favorite, the titer clinic. And finally, discretionary, so as and when one needs it. So I will go through each one step by step, but my focus will be on this, and I'll explain why. So one of the reasons why we have to do titer testing, and I believe it's the future, is because we have the clients who are very, very aware. They're well informed. And, you know, they're all very influenced by Dr. Google. So there is an increased demand from pet owners to not vaccinate every time they come to see you for an annual health check. They want to practice the best evidence-based medicine for their pet. And especially in the USA, I have seen so many who are just happy to come in for a yearly health check without necessarily having the yearly vaccination at that point. And I wanted to put this slide out there to you because, again, this is from the WSAVA, and it clearly says, the question, read the question quickly. It says, in an animal that has completed its puppy kitten shots, is a higher antibody titer required to protect against heavy disease? So you see, they're talking about volumes, number of vaccines, things like that. And the answer from the WSAVA research in 2016 is this. Remember, it's for these vaccines. For canine distemper vaccine, for canine adenovirus, for parvo, and for feline panleukemia, the answer is no. The presence of antibody, no matter what the titer, indicates a protective immunity and immunological memory present in that animal. So just by giving more frequent vaccines to animals in an attempt to increase antibody titer is a pointless exercise. Just digest this information for me. The whole thought process that the more vaccines you give, the more immunized the animal is false. It is impossible to create greater immunity by attempting to increase an antibody titer. So just because, let's say an antibody titer, obviously there are certain values you have to follow if it's rabies, but for these diseases, as long as the animal is positive, it's immunized. It is capable of summoning or producing that immune response and mustering it to fight a disease if it's exposed to the virus, full stop. So giving more frequent vaccines to animals just to increase the antibody titer is pointless. So we move on here. For example, when in the USA, we call it the this is something new because I was in England and this is not what it was called. We call it the annual wellness check. And in the annual wellness check, we do all these things. So we check the weight, we check the teeth, we do sometimes do a blood test, and then we always tend to vaccinate. But now I have clients telling me I would rather VacciCheck and confirm that my animal is protected than rather than just vaccinating. So this is a great opportunity. During your annual health check, instead of just offering a vaccine, you could offer the Titer test and include that in like a package price. Another thing which is very popular in the USA as opposed to England is that we always offer a heartworm test, because heartworm is big in at least certain parts of the United States. And you're going to draw blood anyway for a heartworm test. The same blood you can use to also do a VacciCheck test at the same time. And all you have to tell the owner is that, you want to check if the animal has enough titer before vaccinating. You can get the result on the same day because you're going to do it yourself. And then you can call them up and say, yeah, your dog's immunized, so you don't need the vaccine this year. And you're actually allowed to give, just like the DAP is now being given every 3 years, you can do the VacciCheck every 3 years. So there is a change in how the clients are dealing with vaccinations too. I get, as a holistic integrative veterinarian, I see lots of clients who come to me asking me to not vaccinate and give the annual booster, but instead do a VacciCheck and then decide which way to go based on the results. Another way of doing this would be in a puppy kitten vaccination package. Let's say this is the best kind of practice. This is what we call evidence-based medicine. You're supposed to give the first dose of the DAP or DHPP, as you call it. Note, without the lepto. I'm not saying you should be giving the lepto at this point because it's a non-core vaccine. I'm talking about just the core vaccine here. And if you are going to do the lepto as part of this, that's fine. You could give it on its own and then do a VacciCheck for DAP. So the first dose would be at 6 to 8 weeks. The second DAP dose would be at 10 to 12 weeks. The third dose at 14 to 16 weeks to ensure there are no maternal antibodies. So that 16 week is very important. And then finally, you would VacciCheck the puppy at 4 weeks after the last vaccination to confirm that it is actually immunized, to confirm it's not a non-responder, to confirm that there are no maternal antibodies and everything else. And you could make this like a puppy package. And I'm telling you, this is going to be the future because more and more clients would rather have this than have you just, revaccinate without ensuring that their animal is actually vaccinated. Then we go on to this topic, and I'll tell you how I went about doing my first Titer clinic. And this was in 2015 in Merseyside in England. I was researching for my book called You Can Heal Your Pet, which I was writing with an animal healer. And there was a lot of discussion about Titer testing and about the whole concept of vaccination. And I wrote a whole chapter called The Vaccination Debate. And while I was researching, I wanted to see for myself if this whole Titer testing thing was real, if it was valid, if it was something I could really advocate for in the book. Because I didn't want to, do something I didn't believe in. So fortunately, I met this wonderful woman who was, I know she's not the kind of person you might as a veterinarian want to have in your list of clients. She's an anti-vaxxer, but she had a passion for Titer testing. So she would almost every other week or sometimes once a month, she would get 25 people who wanted to have Titer testing for their pets. And they would come from all parts of Merseyside and from different veterinary surgeries. They're not just my clients. So my aim was not to, steal clients or anything. It was literally just to provide a service. So I would go to her location, which was a raw food shop, with my VacciCheck kit, which would be delivered there. And I would be there from 10 to 4 p.m. She would have booked 24 dogs for the day. And they're all people who are very keen on titer testing. And, they would all sign forms so that we get a history on, what their vaccination history was. I would take blood from 10, 12 dogs in an hour or so. And sometimes they would end up chatting a bit, but yeah, you can just draw blood. And then it was just me and her. We would draw blood. Then they would be quiet and I would sit down with my VacciCheck kit and run the test. 23 minutes is all it took, and I would be doing 12 tests in one go. And that's 12 tests done for the morning. I would fill out the form and pass it on, and the certificates would be ready very soon. Then in the afternoon, another 12 dogs would come in. I would take blood from all of them, and then they would go away. I would again run the test myself in that premise, because I would collect the blood in EDTA tubes so they don't clot. This is something you have to remember. You don't need a centrifuge. You can do it with whole blood. And I would do the test again, another 23 minutes. It's done. I would email them the results the same day, and those who wanted vaccination certificates, I would issue them based on their results. And it was just amazing. It was easy peasy, and it was done. And we had such a good response to it. I was just telling Dr. An, I moved to the USA thanks to my husband. He was headhunted because he works, he's in cancer research, and he's funnily an immunopharmacologist. And, and he was brought over here by Big Pharma, and he works in cancer research, and now he's working on COVID, but for Pfizer. But before I moved, this was such a big hit, this clinic, that I vouched that I would go back and do the Titer clinic whenever I was in England. And I used to travel to England twice a year from the USA to meet my daughter who was studying in law school there. And I would ring up this lady, we would have a Titer clinic, and they would get filled up months in advance. And I cannot recollect the exact number of times, but I'm sure I've done at least 2 or 3, depending on the number of times I went to England per year. And sometimes I would do 2 full clinics of 50 dogs in like 2-3 weeks. And that was the demand, because people believed in it. They wanted to know for sure the dogs were immunized, and they wanted the certificate so that they need not have their pets unnecessarily revaccinated when there was no need for it. So this is an example of my most recent VacciCheck Titer clinic. This is in my current, I have like a little clinic in a holistic shop. And this was on the 17th, not long ago. On this occasion, I didn't advertise for 24. It was just 12 because I wanted to see how it goes. And see, that's why I'm saying you can play it by ear and decide how many you want to do in a day. And it was good, and it was smooth, and it was fantastic. So this is the USA scenario. And I would like to share with you my top tips for conducting a successful VacciCheck Titer clinic. You've all heard of vaccine clinics. They're very popular. In fact, there are huge clinics here which just go out and vaccinate all day. They just do rabies. Sometimes they just do DAP. They're called wellness clinics, and they just vaccinate all day. And I took the same idea and decided to VacciCheck all day. So I usually pick a Saturday because that day seems to be the most popular as far as clients wanting to come in. I would advertise well in advance. You can use email, you can use social media, you can, your receptionists can talk about it when people come in. And when you send out your annual reminder, you can also tell them that there's a Titer clinic schedule for this day, and they could always book in so that by the time they come in for their annual, they can decide if they want to have, if they fail the titer, they could have a vaccine, or they could just not need the vaccine and would just have the full health check. And I usually advertise 4 weeks in advance, and I leave, and if there are spaces, I would again re-advertise 2 days ahead to make sure I fill those spaces. And depending on what you want to do, like I did 24 in England, and here 24 to it sometimes, but mostly 12. And I would create a waiting list for no-shows so that you would be surprised how much demand there was. So we would tell them, we'll call you if we get a space. You must be thinking, why is she harping about multiples of 12? It's because I told you the kit comes in a pack of 12. So you can do 12 tests in 23 minutes. And you can do it, so it comes in boxes of 12. And I like to finish the whole kit on that day, because it saves me having to, you know, store the plate separately and then cut and all this business. So anyway, so that's why I work in 12s, and I think that's the most sensible way to do it. But, you know, if it doesn't fill up, you can always cut away and store the unused part and use just the whatever numbers you need to do for the day. Then I would obtain a vaccination history. So they would have like a little paper that they have to sign off, where they would tell me when the dog was last vaccinated. They would also show, I would also ask them, has your dog ever had a bleeding disorder or any problems when they took blood? You'll be surprised. Some of the people who turn up for these clinics are people whose dogs have never been to a veterinarian. They have never had a vaccine. They have never been ill. And, you know, it's amazing that you see these first timers and you have to ask these questions, because what if, you know, you taking blood and this animal has a bad reaction? So you should have, you know, some sort of safety. But I have to admit, I've done about hundreds, and I've never had a single case that was with any sort of disorder or didn't have any problems. They also have to give consent for me to run the test. So I make sure they sign, because America is a very litigious society, and I always like to cover myself. They've already been explained what this whole clinic is about in advance, so they know what they're in for. So it's me and one vet tech, or it can be 2 vet techs, but with me, it's just me and a vet technician or a nurse. I give them 5 minutes to 10-minute appointments so to draw blood, because sometimes you can have a fractious animal. Because of COVID, they had to wait outside, and I just had my technician went and got the animal in. I drew blood, numbered the tube, it's ready to go. And once I had all the 12 ready, or all the 24 ready, depending on where I was doing it, I was ready to test it. This is important. You have to price it right. Now, a lot of times you'll have clients asking, why am I paying for so much or whatever money for a titer test when I could get a vaccine for a lot less? You have to explain to them something like this. Like I say, I give this example. The medication for hyperthyroidism, for example, methimazole or felimazole, is very, very cost cheap. But the test for hyperthyroidism is expensive. This is basically a test. It's not a product. If you can explain this difference to them, and you can explain how important it is to actually know if your pet has antibodies, they are fine with it, you know. And some of them came to me because they said their titer tests in other places were a lot more expensive. So how do you make sure your price is right? You have to phone around. So I got my practice manager to ring around, and she checked for me what people were charging for titer testing. And I picked the lowest price, or you can pick in between, whatever works for you. And then I keep telling them that the biggest advantage is that you provide test results on the same day, which, you know, gives them that time to go back and then book in for a vaccine if their test by chance fail the titer testing for the core vaccines. I also did something else. I would tell them that if their pet failed the titer test, I would offer them a discounted vaccine. So as veterinarians, we all know that vaccines don't actually, the actual vaccine doesn't cost much. What we charge for should be the annual health check, your expertise in examining every part of the animal. The actual vaccine cost is fractional. So we can well afford to give them a low vaccine at a discounted price if, God forbid, their dog fails the titer test, which does happen. Now, I wasn't going to show this slide, but a lot of people, vets I have met, when I talk to them about doing titer testing, always worried about expense. They keep saying, oh my God, I'm going to lose out a lot of money if I don't vaccinate animals every year. And I keep telling them, it's not the case. This is just an idea of what I have made in the past. It might not happen every time, and this is definitely based on the current situation in New Jersey, and it's in dollars. So I usually order 2 VacciCheck test packs from my supplier, and 2 packs of 12 would probably cost me about that much. Obviously, if I buy like 100 pack, it'll be a lot cheaper, but I'm just saying when you start off, do small. So maybe go for 12 and just order 1 pack and see how you get on. Here, this is the price for a vet technician or whoever is helping you restrain the dog. And this is going by average. You know, some texts, this is all, how shall I say, it varies for each one of you. Your situation is different, what you pay a technician is different, everything. But I'm just giving you a ballpark of what I did. And then in this case, that was me. So obviously I paid myself, I would end up making a lot more profit. But if you were doing it with just 1 vet and a tech, I think a veterinarian is important in case there are issues. And also because I would like the veterinarian to run the test unless they're 100% confident that the technician knows it very well, in which case a technician could do it. And then you can be there to certify and to read the results and reconfirm that, you know, that this result is accurate. And this is what, so let's look at it. So this is for 4 hours. And let's say your expenses came up to $860.62 for the day. And this is what I charged for the titer test per dog. That was about $120. You might say, oh, that's a lot. I am telling you, I shopped around and there were people whose titer test price was $180. There was, if you had to send it off for a virus neutralization test or a hemagglutination inhibition test to do the gold standard test in a laboratory, it would cost you that much easily. And you might say, oh, well, that's a much better test. There is proof. There is a paper I can show you which clearly says that the VacciCheck result is as good as the gold standard. So you don't have to worry. It does work. And because of that, you can reduce the cost to the client. So I only charged $120. And you'd be surprised. The people who came to the Titer clinic said, why did you? I always ask them, why have you come to me? And they say, oh, you're a lot cheaper than so many other people. And I was surprised. And that was the truth, because there are people who are charging a lot more. And then if you look at my expenses, just do your math. And there you go. Just the profit from that one day, or I would say 4 hours, it's like $2,000, right? And which I think is another, let me put it like this. We have bills to pay and we have to worry about costs. And I don't see how you can lose out on running a Titer clinic. It's unless you haven't advertised properly and end up with 2 people showing up, maybe, but then you just pack up and leave. So what I'm trying to say to you is that you do not lose income. In fact, it can be a profitable venture too, apart from the satisfaction that you've practiced evidence-based medicine. So here you go. So It's a win-win situation as far as I'm concerned for everybody. For the pet, they benefit from a reduced vaccine load. Plus, we are confirming that they are immunized and protected. So this is the important part. Remember, vaccination is not equal to immunization, okay? The next thing, the pet owners do benefit from a better price as compared to a reference lab Titer test. At least it'll be $50 less. And if you don't mind taking a cut further, you can make it cheaper, as cheap or as expensive as you like. I like to always go on the lower side because I want more people to benefit, because I'm passionate about Titer testing. I'm passionate about not over vaccinating. So I always price it just right. And that's what I do. I also explained to them that if I had to do an individual test, it would take me 23 minutes as opposed to doing 12 tests in 23 minutes. So I would charge them a little extra if I had to do it, just do one test for a person, and they understand that too. And as far as our welfare as a veterinarian goes, or our revenue goes, I find this time saving and it's a good revenue for the amount of time you'd actually be spending. In fact, if you have a very good nurse who can draw the blood and everything, it's only going to take you 23 minutes. And then, signing some paperwork to do 12 tests. Same time as it would cost, as the effort or the time it would take you to do, one test. So I see it as a big win-win for everybody, which is why I absolutely love running these Titer clinics. Finally, look at all these people. They are key opinion leaders in the world, and they all endorse VacciCheck. These especially Professor Ronald Schultz from the University of Wisconsin and Professor Richard Ford from North Carolina State University. They've done some amazing work, and I've read all through their research papers, and the evidence is there. There's no doubt about it. And then look at their comments, like see what Dr. Ford says. Antibody titer testing for core vaccines can be a useful and a very reliable tool to determine if an animal has seroconverted after vaccination and to decide if the individual animal needs a revaccination. So this is basically your indication for titer testing. And then you have the wonderful Dr. Schultz, and he says, the VacciCheck is a rapid, simple test. It's reliable. This is the important thing. It is reliable because I have double checked it with the VNT or the other tests too. And it's an excellent in-house assay, and it's very useful to determine if a dog requires additional vaccination. I would like to leave you all with this little slide. Hippocrates, the father of medicine, has said the first basic tenet in medicine, practicing any kind of medicine, is do no harm. And titer testing helps you in two ways. Titer testing helps the animal by confirming the immunity, ensuring that it's protected. At the same time, titer testing reduces any possible harm that could be a result from vaccine overload. So I make it a habit to help, or at least not harm. And I would like all of you to practice evidence-based medicine and do what is right by these wonderful animals who need us to do the right thing by them. Thank you very much for being there today and joining me in this presentation. Thanks again to Biogal. Thanks to Dr. An and everybody for letting me do this presentation. Thank you.
Thank you so much, Dr. Sathish. Wow, what a great presentation that you did, and the questions have come pouring in. We are, frankly speaking, out of time. So we're going to just go through two very quick questions. And for all of you who have submitted questions, we do promise to follow up with you. In fact, this presentation will be stored and available for future viewing. It was a very high quality presentation. And we will be following up, as I mentioned, with all of the questions that you have submitted. We do apologize that we had some difficulties with our poll question that we were going to ask, but perhaps we can follow up with each of you and ask you this poll question individually. So let me quickly get to two questions or points. One of the questions came from Maryland, and this comes from a veterinary technician named Marie. She was asking Dr. Sathish that she titers her own animals. She has a young adult cat that had a low or negative titer for FVRCP. They vaccinated that week, and she's asking, should she titer test again this year or vaccinate? Would this determine whether the cat, is a non-responder or if the vaccine had poor immunogenicity?
First of all, we need to know if your cat had been vaccinated previously. And if your cat had definitely been vaccinated and was still showing a negative result, I would say, first of all, repeat it to be sure that your test is valid. And as far as I think you're talking about the VacciCheck. Has she mentioned that, Dr. Ron?
She did not mention which test platform
Okay.
she used.
So to be on the safe side, I would give like a 4-week gap and retest after the vaccination to be sure that she says she uses Antec. Yeah, you can go ahead and retest, or you could wait a year and retest if your cat is indoor. And again, it depends on the lifestyle of your cat. I always believe in personalized medicine. As far as your cat goes, if it's an indoor cat, then you don't have to worry too much about revaccinating. But if it's going to go outside and you're worried about what it could pick up, and your cat, he or she would pick up, then I would strongly advise titer test again to just be sure of what's going on. If you are 100% sure that your vaccine is ideal, it's the modified live vaccine and everything else, then it's possible that there is an issue with immunogenicity, and you have to be extra careful as far as the animal goes. But there's nothing wrong in if it's a total negative to do to vaccinate and then recheck the titer in 4 weeks. That's what I would do.
Great. And then very last question, because we are about to lose this link, folks. Professor Richard Ford, who you referenced as a key opinion leader who's based at North Carolina State University, Dr. Ford commented that perhaps you might address the significance and interpretation of a negative antibody test result in the young post-initial vaccination series dog versus an adult dog.
Yeah, I mean, I remember reading your paper, Dr. Ford, and you've also talked about memory cells and B lymphocytes, and how that even if an adult dog tested negative, it's fully possible that it is capable of an immune response if it's exposed to the virus. So they don't necessarily need to be revaccinated, even if they have a negative result. Whereas in the case of a puppy, because it hasn't had that amount of time, I would recommend that puppies are revaccinated if there is a negative result. And I would recheck the titer to make sure that they are not non-responders or anything else is going on, because all these diseases do tend to affect puppies more, and I would be concerned about them more than an adult dog, which probably, if it has been vaccinated at least once in its lifetime, is okay because of the memory cells, which I'm sure would help in the event of an exposure.
Great. Well, thank you so much, Dr. Sathish. It was a wonderful presentation. And for all of the other folks that we were not able to get to your questions, we will be following up with you. We thank everyone for coming to this Biogal sponsored presentation. And we hope that you will all stay safe and healthy and have a happy holiday season. Thank you.
Thank you very much.